If you feel like you are absolutely freaking drowning on your shift as a new grad nurse, it's probably because you're not doing this one thing. Nursing school taught you everything, right? Except how to delegate. And if you feel like you're drowning, it's probably because they didn't teach you that leadership and delegation is part of what you earned when you put that RN behind your name and passed the NCLEX. So today, I'm going to share 5 reasons why new nurses don't delegate more often and how to overcome those. My name is Jessica Smith Dos Santos. I have been a nurse since 2005. Whoop, whoop. High five to 20 years in nursing. And I have the pleasure of coaching and mentoring new grad nurses. And this is one of the areas where I see them feeling so incredibly uncomfortable is when it comes to delegating tasks to their CNAs or their techs or even to other nurses who come to ask for help. And I found 5 kind of common reasons why they're uncomfortable delegating. And I'm here today to bring those to the forefront to help you, my fellow new nurse, learn how to overcome these fears and these common challenges to really step into that power of delegation so that not only can you leverage your teammates for what they were hired to do, but also so that you don't feel like you're drowning and your patients are getting more consistent and safer care. So, reason number 1 is because as a new grad nurse, and maybe it's your personality type, that you fear conflict. And that's a very normal thing, especially if you have not been given the skills to have sort of crucial conversations in ways that encourage collaboration. And also, like delegation is a leadership skill, right? So you probably weren't taught how to communicate from a leadership standpoint, and you're seeing yourself as still very new. And what I can share with you is that, yes, conflict might happen. It's a normal human experience, whether you're at home with your spouse or with your child or with your one of your parents or one of your friends. Like, conflict is going to happen, and learning how to lean in and navigate that conflict is an area of personal growth for all of us. And in the professional setting, what I want you to know is that your CNA or your tech or the LPN that's working with you, they were hired specifically as support staff to support you in doing the tasks and the roles that they can do within their scope of practice so that it sets you free to be able to do the tasks that you have in your scope of practice. So what I'm going to share with you is when you feel that all too familiar fear of conflict, I want you to take a deep breath and lean in and check the stories that are going through your head. What is it exactly that you're most afraid of? Are you afraid that the CNA will give pushback? Are you afraid that you won't say it right? Were you afraid that somebody will tell you no? What are you most afraid of? And when you can call those fears up to the carpet, to the front, it makes them so much easier to navigate because you're going to realize your tech or your CNA were hired to support you with doing those tasks. Okay. So when it comes to feeling fear of conflict, call out those lies, call out what you're most afraid of to help dissolve them, bring them into the light so that you can be more aware of what that underlying fear is. And then remember that delegation is part of your job. It's part of the leadership that comes with that RN behind your name. Number 2 is lack of confidence. Of course, when you are a brand new grad, you're still learning how to trust your own judgment. You're still growing even the skills that you can delegate. Maybe you still feel a little bit unsure of what exactly you're allowed to delegate and who you're allowed to delegate it to. So, without a clear understanding of what tasks can be delegated ethically or safely, or tasks that you're still learning and you're just not sure about it, it can absolutely lead to a lack of confidence, which then leads you to staying quiet. It leads you to a place where your plate is overly full, you're feeling overwhelmed, you know you need to ask for help, but you're not sure, you don't have the confidence. And this is where that's the moment where you lean into a senior nurse, lean into a mentor, lean into your educator, lean into your charge nurse, and just say, hey, I feel overwhelmed. I have all of these tasks on my plate, and I'm just not sure which one to delegate or how to move forward properly. Lack of confidence in the beginning just simply means that you haven't learned to trust yourself yet. Confidence means to be able to confide in yourself, to be able to trust in yourself. And that, my friend, is a skill that will grow as you continue to practice. One thing that you can do that will be excellent in helping you learn the difference between what you can delegate and what you should delegate and what can't be delegated is ask a fellow nurse, like, hey, if this was your task list, what would you delegate and who would you delegate it to? That's a great way of leveraging curiosity to learn that skill of delegation, but also to start building trust in yourself. And by the way, hot tip, the best way to start developing confidence is to start delegating. Because once you start delegating, you are going to see so clearly more and more and more evidence for what can be delegated, and it's going to grow your confidence. The third reason that I see new grad nurses not delegating is this little thing called imposter syndrome. Many new grads feel like they haven't earned the right to lead others or to delegate, and they're afraid of coming off as bossy, especially if the new nurse is younger than the CNA that's been on the floor for 15 years. Right? Especially if there's an age gap. Of course, imposter syndrome is just simply a mechanism of saying, I don't have a lot of experience. And it's a social mechanism that's telling you, I haven't earned the social right to be able to delegate these tasks. And what I want you to know is that both of those are lies that are keeping you trapped and feeling overwhelmed, exhausted, and like you're absolutely drowning during a shift. So just like when you feel fear, when you feel imposter syndrome and you feel those stories come up of like, I haven't earned it yet, I'm still too new, I want you to call those out for what they are. They're absolutely and complete lies, and they're total and complete bullcrap. Because the truth is, when you passed the NCLEX and when you got that RN behind your name and when you got hired for this job, you automatically earned the right to delegate. And that is why the department that you're working in has hired support staff to support you in the tasks that can be delegated. So again, with imposter syndrome, similar to fear, I want you to breathe into that and call those lies forward and then combat them with the truth. You are a registered nurse. You have tasks that only a registered nurse can do that nobody else in your department can. And the other things that other people can do should be delegated to them. That's what they're there for. And that's part of your job and the right that you earned when you got that RN behind your name. So you are not an imposter just because you're new, and you're not an imposter and haven't earned, you don't have to earn the right to delegate. That comes with the RN behind your name. Number 4, some nurses, especially new nurses, feel guilty for asking to delegate because let's be real, some of the tasks that we can delegate, like personal hygiene or cleaning up a patient that maybe wet the bed or soiled the bed, postmortem care, things like that are kind of dirty, right? Like they're yucky, they're dirty, like nobody really wants to do them. Like I don't want to do them. I don't know any tech or CNA that I've delegated to that like is jumping up and down to do postmortem care because like that's their favorite thing. So the tasks like that we can delegate are sometimes like a little bit more of the dirty work. And that's just a fact of what we do. It's a fact of what we do as nurses, and it's a fact of what we do as a CNA or a tech. I started my career as a CNA. And I showed up to work expecting that the nurse was going to delegate those tasks to me because there are only things that the nurse can do that I cannot. And in coming in and supporting with the nurse with those tasks that I can do, I'm clearing his or her plate so that he or she can stay solid in the lane of taking care of the things that only he or she can do under her license, under his license, right? So, from the perspective of having been a CNA, I expect that the nurse is going to delegate tasks to me: vital signs, postmortem care, personal hygiene, mealtime, stocking rooms, cleaning rooms. It was a very clear expectation that that was my role, and that my role as a CNA or a tech was to support the nurse, which meant that the nurse has that clinical judgment to say, these are the things that I need support with so that I can finish the things that only I can do. So don't ever be afraid or feel guilty of delegating some of that harder work or that dirty work, so to speak, to your support staff, because that should be an expectation for them. They know when they got hired what their job duties include. And they also know that their job duties do include some of the dirty work and some of the hard work, right? So don't ever feel guilty, because we are all in this together, and our goal is to provide excellent patient care. And by not delegating tasks and allowing yourself to be overwhelmed, it sets you up to make mistakes in things that only a nurse can do, like giving that IV push or verifying those medications or giving high quality teaching. You can't do those things well and effectively if your plate is full of like cleaning bedpans and doing toothbrushing and cleaning up after meals. Like, that is not appropriate. And there's no reason to feel guilty for doing your job effectively and safely and leveraging the teammates that they have given you to partner with you to give excellent patient care. Last and not least is number 5. And I actually find this one to probably be like the top of the list, the most common reason that new grad nurses don't delegate. And that is the desire to be liked. And that's a very normal, natural human desire, especially when you're brand new. Like, it's so important in terms of teamwork and camaraderie and communication to feel like you're part of the team, to feel like other people like you, to have a sense of like, I'm getting along with my teammates. Because let's be real, nursing is hard work. Like, it's hard work. It takes an intense amount of critical thinking, and the shifts are long. It's already hard enough just to show up and take care of your patients. But when you're also fighting a coworker or a personality conflict, or you're not getting along with one of your teammates, and you're fighting that desire to like, I just need to be liked. Like, it's hard enough to be a nurse, and it makes it even harder when you're not getting along with your teammates. That could be like one of the number one most difficult reasons every new grad nurse is afraid to delegate, because they're afraid that it might damage the relationship. It might make them look demanding. It might ruffle feathers. But the truth is, our job is to provide excellent and safe care for our patients. And the truth is, we can't do that if we show up with the primary objective of being liked. And the truth is, the way in which you delegate tasks makes a huge difference as to how it's received. Okay, so just some simple language that I can give you that will make or break how it's received is, you can come off bossy and not likable by saying, go do this, right? It's very direct, it's very clear, but it also can feel very impersonal. Whereas if you approach a tech and you say, hey, I'm drowning with some of my nursing tasks, and I really need your help doing these 2 things that would make a huge difference for my day. Would you be willing to do those 2 things for me? That's a huge, huge difference, because instead of like demanding that they go do something from a status of I'm the nurse and you're the tech and I'm the boss of you, you're coming from a place of like, I'm struggling as your teammate and I need your support because we're working together to do this. So just a quick shift in your language and how you ask can make all the difference as to how it's received. So at the end of this like video today, what I want you to hear from me is that you are an RN. And there are things that only you can do as an RN. And by not delegating, you are perpetuating a problem of number one, feeling like you're drowning, and number two, diminishing your effectiveness to give clear, concise, safe, efficient patient care. So always remember that you already earned the right to delegate. And the hospital has hired support staff to support what you do in your role as a nurse. So don't ever be afraid to delegate. And as a matter of fact, I encourage you to delegate more often. I hope this has served you. I can't wait until the next video. Much love.